tumor makeup changes through the course of disease. Regular biopsies needed to ensure correct treatment in patients who relapse. And I think this is a very important piece of information because we tend to treat the disease that the women had, not that the women actually are having. So, please.
Thank you. So, good morning. My name is Linda Lindstro, and I'm a postdoctoral fellow at the Department of Oncology and Pathology at Karolinska Institute here in Stockholm. So, this morning I want to talk to you about the fact that clinically used breast cancer markers are unstable throughout tumor progression. Clinical management of breast cancer relapse is often based on primary tumor characteristics such as estrogen receptor, ER status, progesterone receptor, PO status, and human epidermal growth factor receptor 2, called HER2 status. And as you know, ER status and HER2 status predict treatment response. So in patients with ER-positive tumors, the tumors need estrogen to grow, and these patients generally receive anti-hormonal treatment. While breast cancer tumors in HER2-positive patients make too much, they overexpress the HER2 protein that promotes cell growth, and drugs are also available here to target the HER2 protein. So our aim was to assess inter-individual ER, PR, and HER2 status throughout tumor progression. And specifically, we wanted to understand how the markers alter within the patient between primary tumor and first breast cancer relapse, in addition to between several sites of relapse in the same patient. Our cohort is defined by female individuals diagnosed with a local or systemic relapse in the Stockholm healthcare region from January 1997 through December 31st, 2007. And the intra-patient marker status were manually collected from original pathology reports. So to summarize our findings, here we see the ER status in primary tumor and first relapse site from the same patient. So in summary, we had 459 breast cancer patients where we both had a primary tumor ER status and relapse ER status available. And we could see that in the primary tumor, 72% of the patients were ER positive, while 28% were ER negative. And for the ER positive tumors, we could see that a little bit less than half of patients continued to be ER positive in the relapse, while 1 in 4 patients lose ER receptor at relapse. For the ER negative patients, we saw that one out of 5 patients continue to be ER negative stable also in the relapse setting, while 8% actually gain estrogen receptor status at relapse. So in addition, we also looked at several consecutive relapse sites from the same patient. And at the first relapse, a little bit more than half of the patients were ER positive, while a little bit less than half were ER negative at first relapse. Out of the patients being estrogen receptor positive, a little bit more than a third of the patients were stable ER positive all through the relapse setting. And I want to mention that we had collected information on from 2 up to 6 relapse sites from the same patient. And in the estrogen receptor positive patients at first relapse, we also saw that 16% lost estrogen receptor status during the relapse setting. While for the ER negative patients, we saw that a third continued to be ER negative all through the advanced disease, while 13% gain estrogen receptor status during disease progression. So So in a clinical setting, the implication of estrogen receptor instability is important because loss of estrogen receptor generally means resistance to hormonal therapy, and these patients would benefit from a therapy change. And in addition, an estrogen receptor gain in the relapse setting would also introduce an additional choice of therapy that could potentially in some patients lead to tumor response and prolonged survival in the metastatic setting. And in conclusion, since therapy predictive markers are unstable through tumor progression, this dynamic brings forward the potential need of taking biopsies in a continuous manner, also in the advanced setting, to enable optimized treatment decisions for the patient. Thank you very much.